Hello, everybody, and welcome to another episode of RN Cliff Notes. Today, we're talking about cardiac electrophysiology, heart wiring. How is the heart wired? Okay, so RN Cliff Notes. We're helping students to see through larger concepts by teaching you to study smart. And I'm Cliff Davis. I am the Associate Dean of Nursing and longtime advanced medical surgical professor, okay? So, flashing back to our previous video, right? So we're building on our concepts. So here's our icebreaker challenge for this video, okay? This time, what I need you to do is pretend that you are a red blood cell and you're starting in the leg. And I need you to identify each structure that you would touch as a red blood cell as you were on your way through the vessel, into the heart, and then on your way to the lungs. So, what would you touch? You're starting in the leg, and then identify each structure that you would touch on your way to the lungs as you traveled from the vessel into the heart and to the lungs. All right? Okay, pause the video if you need to, and you should come up with a number sequence based on those structures. So you know the structures, but you should come up with a code. What would be that code number if you were that blood cell? Okay, and your code should be as follows: 8, 5, 6, 7, 4, and 2, or you might opt to use structure 11. 2 or 11, they're interchangeable. You can pick either one of those, but it should be 8, 5, 6, 7, 4, 2. And here, let's double check our work. Okay, so you're that cell. We said you were starting in the leg. If you're coming from the leg, you're going to come up through the inferior vena cava, number 8 there. After that, you're going to come out of the inferior vena cava into the right atrium, which is number 5. From there, you're going to go to 6, which, what's the name of 6 again? And you say tricuspid. Good job. The tricuspid, because that's on the right side, right? R-I-T, good job. Now, 7 after tricuspid, you're going to go through the right ventricle. Yes. So 8, 5, 6, 7 so far. Then after 7, you're going to travel up this tube here to 4. All right. And what is that? What is 4? And that is the pulmonic valve. Excellent. Pulmonic valve. All right. So then after that, coming through the pulmonary circulation here, we got branching off to number 2, headed to the lungs, or we got branching off to 11, going to the lungs. So you could have picked either one of those pulmonary arteries, 2 or 11, right? So ultimately, 8, 5, 6, 7, 4, 2, or 11. All right, good job. All right, so number your paper or your device, whatever it is you're using. Preferably you're writing it down, yes, okay? And you need to number your paper 1 through 6. And here's why. Because we're talking about the electrical system in the heart, and this is what we want you to tackle. Identify the parts of the electrical system of the heart, starting with number 1, 2, 3, 4, 5, and we'll wrap up at 6 for the wiring for the heart. Okay, so you should have the following. Number 1, of course, is what? The natural pacemaker of the heart. Now, when this one is damaged, that's when your patient needs some type of pacemaker many times, right? So they need some artificial pacemaker. But the natural pacemaker of the heart is the SA node, sinoatrial node. Now, I want you to catch the root word there, sino, that part. So, sinus. Okay, so when you hear sinus, you've heard of a normal sinus rhythm. What is that saying? Your client has a normal rate in their heart, and their impulse right? Electrical impulse in their heart is originating in the SA node, the sinoatrial node. Now, that will give us a range between, a pulse range between 60 and 100. But when we go outside of those parameters, then the name changes. It's no longer normal sinus rhythm, or you'll see many times abbreviated NSR, normal sinus rhythm, but that's 60 to 100. Well, how about if the patient's pulse rate is greater than 100? Then we're going to call it sinus tachycardia many times, if the impulse is originating in the SA node. It would be sinus. See, it is sticking with that word. So sinus tachycardia. And if the pulse is less than 60, then we're talking about 59 or lower, right? Sinus bradycardia. Again, yes, they're having bradycardia, but where's the impulse originating from? From the SA node, right? Great. All right, good job, guys. So this is the primary structure. Let's move on to the secondary. Secondary electrical structure. That would be the, what do you think it is? It is the AV node, of course. Yes, good. Atrioventricular node. Or many times you just hear people say AV node. So this is the secondary structure, right? And it's located where? Approximately between your atria and your ventricles. So it gets the name AV node. It's in between those two structures. Okay? Now, what tertiary electrical structure does the impulse travel to next? So we have primary, secondary, tertiary. By the way, we're just going to bounce this off of some of your fundamentals because it's been a long time since some of you have had fundamentals. And you've kind of forgotten some of that stuff. So, just a quick flashback. So, let's use your healthcare. So, you go to see your PCP. Who? Your primary doctor, your primary care physician. And if your primary care physician feels that the situation that you have is above them, like you need a specialist, right? They're going to refer you to the specialist, who would be the secondary level of care in the medical system, right? And if that specialist feels like this is something I can't treat while you're visiting me in the office, I need you to go to the hospital and get admitted, then he would be, or she would be, admitting you to the what? Tertiary level of the medical system. So hospitals are tertiary levels. Primary, secondary, tertiary. All right, good. Back to what we're doing. So tertiary structure, we had what? SA node, AV node. Number 3 in our structures would be the bundle of His. Bundle of His. And with the bundle of His, it just heads up, be careful, because sometimes in examination, your teachers might actually use a different word and say atrioventricular bundle instead of the bundle of His. But don't be thrown off. Atrioventricular node, atrioventricular bundle, those are different, okay? But for my exams, and generally speaking as educators, we try to stay away from that and just make it atrioventricular node and just the bundle of His, right? Yeah. Okay, so now, quaternary. Hooray, quaternary, right? What a great word that is. I love that word. So, what quaternary electrical structure does the impulse travel to next? All right, and that would be the one that I love to mess up, and if I do, then hey, sorry about it. You know, this would be like, take 20. Okay, so, right and left bundle branches. Right and left bundle branches. Now, a little bit of insight, and here's where I get tripped up. Yeah, right and left bundle branches. So, with your right and left bundle branches, they're coming out of the bundle of His, and they're branching out, right? And they split, and we'll see this in a diagram shortly. So they branch out from that bundle of His, and that's why they get that name, bundle branches. But now, so let's say you're looking at your patient's chart, and you see this abbreviation in the history and things your doctor wrote, BBB. Say something like LBBB or RBBB. And all that's saying is your patient has right or left bundle branch block. And what does that mean? It means this. So instead of being able to travel normally down the fiber pathways in your heart, right, through the rest of the wiring, your patient has a blockage there. And as that impulse comes towards the blockage, it has to pause and make its way around that blockage to continue down the fiber and the wiring, right? So yeah, BBB, bundle branch block. Okie dokie. So now, let's go a little further. And of course, this would be wrapped up where? In the wiring of the heart. Perkinje fibers, Perkinje fibers. Careful with the spelling on that, right? With a J-E, Perkinje fibers. Okay, let's look at the overall view. So, we've got the SA node, the natural pacemaker of the heart, right? Traveling down the fibers. And the next spot that it hits, the AV node. And a close neighbor to the AV node is the bundle of His, as we said. And then we said that bundle does what? Split. And it splits into the right and left bundle branches. By the way, all right? We're going to take our hands, when we're studying the heart, we've said in previous videos. And this helps us to maintain our orientation as we're studying the heart. So the right bundle branch is on that side, and the left bundle branch is this way. So big help as you're deciphering and trying to identify parts of the heart. Cross your hands, right? It's a big help. Okay, and the Perkinje fibers in the end, and those are like almost like frayed wires going up the walls of your ventricles and things, sending the rest of that impulse down that track. Perkinje fibers. All right, good, good. So that's our overview, and I want to thank you guys for liking and subscribing, especially you subscribers. So keep studying smart, guys. All righty.